After you've completed all of your initial treatments for breast cancer, the question then becomes, what goes on? What's the routine follow-up? What things should be done regularly? What I'd like to share with you is a lovely resource that you can download and review yourself. This is called the NCCN Guidelines for Breast Cancer Patients. NCCN stands for the National Comprehensive Cancer Network. These same guidelines are used by us at our cancer center. This is an example page, a little more complex than what you'll see in the layperson's version, but we use these guidelines at our weekly multidisciplinary breast conference to make sure that we're in line with these national standards. These national standards are widely accepted. So I'd like to share with you what NCCN suggests as part of the routine follow-up for patients after they've had their initial treatment. For the first 5 years, a patient should be seen every 4 to 6 months. Now, typically at my place, I see patients twice a year. One of those times is when the annual mammograms are done. My medical oncologists usually see the patients 3 times a year. In the middle of all this, the radiation oncologist may want to see the patient once or twice. So during that first 5 years, the follow-up is pretty intense. Well, what goes into that follow-up? Well, first of all, obviously a physical exam and a history. Second of all, yearly mammograms are absolutely recommended. Thirdly, if a patient is on tamoxifen and has her uterus, then a yearly gynecologic examination is recommended because there is a small yet real risk of increase of uterine cancer. Women who are on aromatase inhibitors, AIs, should have regular bone scans done because one of the side effects of AIs is demineralization, loss of calcium in the bones. And this is obviously suggesting that calcium supplements are needed, things of that sort. Maintaining an active lifestyle, healthy weight. You've heard me talk about this repeatedly at Breast Cancer Answers. Now, every now and then I get a question, well, what about CT examinations, or what about PET CT examinations? As part of the routine follow-up of stage 1 and stage 2 patients, I think the use of annual CT examinations is not well supported. Think about the extra radiation that you're getting from these exams, so it's not well supported at all. Now, once we get into stage 3 disease, or of course stage 4 disease, then the situation is different, and monitoring for systemic failure at that level of the initial cancer may be more important. Interestingly, in the NCCN guidelines, the routine use of CT scan or PET CT scan is not recommended unless we know a patient has got a recurrence. I've also shared with you previously that the follow-up for breast cancer is a lifetime journey. If you have estrogen receptor positive breast cancer, the first 5 years is wonderful, but the next 5 years and the next 5 years after that are really important. Yes, it's true, we can see cancer come back elsewhere in the body in that second 5-year time period, so you do need to be monitored, need to be seeing your providers on a regular basis. So I strongly recommend that you take a look at nccn.com, that you look at these guidelines for breast cancer patients, make them part of the data and information that you have so that you feel fully empowered. Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
About personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
pass it on.